So, always ask your healthcare provider before making major dietary changes. The eighth reason is alcohol. Many people assume one drink can never matter. For some individuals, it doesn't. For others, alcohol interacts with medication, affects sleep quality, increases dehydration, and temporarily raises blood pressure. As we age, our bodies process alcohol differently than they did decades ago. What felt harmless at age 40 may have a much larger impact at age 70. The ninth reason is dehydration. This surprises many people. When you're dehydrated, blood volume changes and your body releases hormones that attempt to conserve water. These hormonal responses may contribute to higher blood pressure in certain situations. Older adults are especially vulnerable because the sensation of thirst naturally becomes weaker with age. Some intentionally avoid drinking enough water because they worry about nighttime bathroom trips. Unfortunately, that habit may work against overall cardiovascular health. The tenth and perhaps biggest reason is expecting one solution to solve a problem with many causes. High blood pressure usually develops over years. It rarely has only one cause. Sleep, stress, diet, activity, genetics, kidney function, medication timing, weight, hydration, all of these interact with each other. That's why treating high blood pressure often requires addressing several small factors instead of searching for one magic answer. Now let's move into the practical solutions. Solution number one, have a detailed conversation about medication timing. Don't simply ask whether your medicine is working, ask whether the timing is appropriate, ask whether your readings suggest medication is wearing off too early, ask whether evening dosing or divided dosing could be appropriate for your situation. Again, never make changes without medical guidance. Solution number two, become a label reader. Instead of comparing calories first, compare sodium. When choosing between two similar products, select the one with lower sodium. Over months and years, these small decisions accumulate into meaningful improvements. Many health organizations recommend keeping sodium intake around 1,500 to 2,300 milligrams daily, depending on individual circumstances, but your healthcare provider can recommend the right target for you. Solution number three, create a daily relaxation routine. It doesn't need to be complicated. 5 to 10 minutes of slow breathing, listening to calming music, reading something inspiring, praying, gardening, sitting outside in fresh air. The activity matters less than consistently allowing your nervous system to slow down. Solution number four, take sleep seriously. Many people proudly say, "I've always slept poorly." Poor sleep should never simply be accepted as a normal part of aging. If you consistently wake tired, ask about sleep evaluation. Treating sleep apnea often improves much more than blood pressure. Many people also notice improved energy, mood, and concentration. Solution number five, keep a home blood pressure journal. Measure at approximately the same time each day. Sit quietly for 5 minutes beforehand. Keep both feet flat on the floor. Avoid caffeine immediately beforehand. Write down every reading. Bring the log to your doctor instead of relying on memory. Patterns tell a much more useful story than one isolated number. If you are taking your blood pressure medication every single day, on time, exactly as your doctor told you, and your numbers are still high, I need you to stop scrolling and listen carefully for the next 30 minutes, because what I am about to share is not the same advice you've already heard 100 times. Most videos repeat the same basic tips: eat less salt, walk more, drink more water, lose weight. Those things certainly matter, but they are only part of the picture. Many people follow that advice faithfully and still wonder why their blood pressure refuses to come down. I am Dr. Daniel Carter, and today we're going much deeper. I'm going to explain the lesser-known reasons why your blood pressure can stay high even when you're taking medication exactly as prescribed. More importantly, I'll share practical, research-supported solutions that you can begin discussing with your healthcare provider today. Stay with me until the end because solution number 7, right around the middle of this video, is something surprisingly few people talk about, yet it may explain why your blood pressure hasn't responded the way you expected. Let's begin by understanding what's really happening. If you've ever looked at your blood pressure monitor and thought, "How can this still be high? I'm doing everything right," you're certainly not alone. Millions of older adults across the United States face this exact situation. Every morning they take their medication, attend their medical appointments, and genuinely try to stay healthy. Yet the numbers remain stubbornly high. That experience can be frustrating. It can also be frightening. Some people begin doubting whether the medication works at all. Others wonder whether something serious is happening inside their body that nobody has discovered yet. The truth is that high blood pressure is often much more complex than simply taking one pill every day. Let's go through the biggest reasons one by one. The first reason is medication timing. Many people automatically take their medication first thing every morning because that's how they started years ago, but your body's blood pressure follows a natural daily rhythm. During the early morning hours, your body releases hormones that prepare you to wake up. Your heart beats a little faster, your blood vessels tighten slightly, and your blood pressure naturally rises. Doctors call this the morning blood pressure surge. Now imagine your medication beginning to wear off just before this natural surge happens. Even though you're taking your medicine every day, there may be several hours when it isn't providing its strongest effect. For some people, simply adjusting the timing of medication under their doctor's supervision can make a meaningful difference. Never change your schedule on your own, but it's an excellent conversation to have during your next appointment. The second reason is hidden sodium. When people hear reduce salt, they immediately stop adding salt to their meals. Unfortunately, that's often not where most sodium comes from. Many packaged foods contain surprisingly high amounts of sodium without tasting salty at all. Bread, breakfast cereals, canned vegetables, frozen dinners, restaurant meals, deli meats, cheese, store-bought sauces, even foods marketed as healthy sometimes contain hundreds of milligrams of sodium in a single serving. One sandwich can easily contain more sodium than many people realize. That's why learning to read nutrition labels is far more powerful than simply putting away the salt shaker. The third reason is long-term stress. Many seniors tell me, "Doctor, I'm not stressed," but then they describe worrying about retirement savings, paying medical bills, helping adult children, missing loved ones, living alone, managing multiple medical conditions. Over time, your body adapts to this constant pressure. Stress hormones remain slightly elevated. Your nervous system stays switched on, your blood vessels become tighter. Even if you don't feel anxious every minute, your body may still be acting as though it's constantly preparing for danger. Medication can lower blood pressure, but it cannot completely erase years of chronic stress by itself. The fourth reason is poor sleep. Sleep is when your cardiovascular system repairs itself. During healthy sleep, blood pressure naturally falls for several hours, giving your heart and blood vessels a chance to recover. But conditions like sleep apnea interrupt that recovery. Every time breathing briefly stops during sleep, oxygen levels fall. Your brain responds by releasing stress hormones. Your heart works harder, blood pressure spikes. This cycle may happen dozens or even hundreds of times in one night without you realizing it. If you snore loudly, wake up choking, experience morning headaches, or feel exhausted despite sleeping 7 or 8 hours, it's worth discussing sleep apnea testing with your physician. The fifth reason involves inaccurate blood pressure readings. Many people only measure blood pressure during doctor's appointments, but blood pressure constantly changes throughout the day. Some people experience white coat hypertension, where anxiety inside the clinic temporarily raises their numbers. Others have the opposite problem called masked hypertension. Their blood pressure looks normal during appointments but becomes dangerously high throughout everyday life. Without home monitoring, neither you nor your doctor sees the complete picture. The sixth reason is excess abdominal fat. Notice I didn't simply say body weight. Where fat is stored matters. Fat around the abdominal organs releases inflammatory substances that affect hormone balance, blood vessel function, and insulin sensitivity. These changes can make blood vessels less flexible and more resistant to normal blood flow. Even a modest reduction in waist circumference can sometimes improve blood pressure before dramatic weight loss occurs. Now, before we continue, if you're already recognizing yourself in several of these reasons, please take 1 second to press the like button. Your support helps this video reach other seniors who may be feeling discouraged and searching for answers. Now let's continue. Reason number 7 is low potassium and magnesium intake. Everyone talks about sodium. Almost nobody talks enough about its natural balancing partners. Potassium helps your body remove excess sodium through the kidneys while helping blood vessels relax. Magnesium supports healthy muscle and nerve function, including the muscles surrounding your blood vessels. Many modern diets simply don't provide enough of these minerals. If your meals rarely include leafy greens, beans, nuts, seeds, yogurt, bananas, or sweet potatoes, your body may not be getting what it needs. However, this is extremely important. Some medications and kidney conditions require people to limit potassium. If you've found these tips helpful so far, leave a comment below and tell me which reasons surprised you most. I truly read your comments because they help shape future videos for this community. Now let's continue. Solution number 6, move your body consistently. You don't have to become a marathon runner. Consistency beats intensity. A comfortable 20 to 30-minute walk most days of the week can produce meaningful cardiovascular benefits. Simple strength exercises using light weights or resistance bands may also help preserve muscle, improve metabolism, and support healthy blood pressure over time. The goal isn't perfection. It's building habits you can actually maintain. Solution number 7, gradually increase foods naturally rich in potassium and magnesium. Try adding spinach to lunch, beans to soup, a handful of unsalted almonds, a baked sweet potato, plain yogurt with fruit. Small improvements repeated every day become powerful over months. Remember, if you have kidney disease or take medications that affect potassium levels, always discuss these dietary changes with your physician first. Solution number 8, be completely honest about alcohol. Doctors are not there to judge you, they're there to help. If you enjoy wine, beer, or cocktails, tell your healthcare provider exactly how often and how much. That information helps determine whether alcohol could be influencing your medication or blood pressure. Solution number 9, stay consistently hydrated. Rather than drinking several large glasses all at once, sip water steadily throughout the day. Most older adults benefit from maintaining regular hydration. Although individual needs vary depending on heart, kidney, and other medical conditions, your doctor can recommend the right amount for your situation. Solution number 10, focus on the biggest opportunities first. Don't try changing everything tomorrow. Choose 2 or 3 areas that seem most relevant. Perhaps it's improving sleep and reducing sodium, or increasing activity and monitoring blood pressure at home. Small, consistent progress is almost always more successful than dramatic changes that last only 1 week. Now, I want to leave you with one final thought because I believe it's the most important message in today's video. Blood pressure medication is not failing you. Think of it as one member of a team. The medication is doing its job, but it needs teammates. Healthy sleep, balanced nutrition, stress management, regular movement, proper hydration, home monitoring, honest communication with your healthcare provider. When those pieces begin working together, your medication often has a much better chance of producing the results you're hoping for. I also want to remind you that blood pressure improvement usually doesn't happen overnight. Many people become discouraged after only a week or 2. The body often needs time to respond. Small improvements made consistently for months are far more powerful than perfect habits followed for only a few days. Celebrate progress, even if your numbers improve only gradually. Every small step matters. Finally, I care deeply about your safety. Everything we've discussed today is designed to help you better understand your condition and prepare for meaningful conversations with your doctor. Nothing in this video should replace personalized medical advice. Never stop, start, or adjust prescription medication without professional guidance. If your blood pressure suddenly becomes extremely high, or if you experience symptoms such as chest pain, severe shortness of breath, sudden weakness, difficulty speaking, vision changes, or a severe headache unlike anything you've experienced before, seek emergency medical care immediately. Your health is too important to ignore warning signs. If you've stayed with me until this point, thank you. That tells me you're serious about taking control of your health, and I'm honored to be part of that journey. Before you leave, I have 3 quick requests. First, subscribe to the channel because every week I share clear, research-informed informed health information created specifically for older adults who want practical advice without confusing medical jargon. Second, if this video gave you even one new idea or answered a question you've been wondering about, please press the like button. That simple action helps YouTube recommend this video to other people who may be struggling with the same problem. And third, leave a comment below telling me which health topic you'd like me to cover next, whether it's cholesterol, diabetes, arthritis, memory loss, sleep problems, medications, heart health, or healthy aging. Your suggestions genuinely help me create videos that answer the questions real people are asking. Take care of yourself, be patient with your body, keep asking questions, keep learning, and most importantly, keep working together with your healthcare team, because understanding your health is one of the greatest gifts you can give yourself. I'm Dr. Daniel Carter, and I look forward to seeing you in the next video.